Hello, ladies and gentlemen. I am Joy Kai, and today we will be talking about inflation within the pharmaceutical industry. Inflation. It's seen as a bad thing because it lowers the purchasing value of goods and services. We will talk about 3 different pharmaceutical companies who's increased the prices of very important drugs and medications. Lobbying, research, development, and underlying greed are sources of inflation of these life-changing medications. Stay tuned to find out more. In 2015, Turing Pharmaceuticals shot up the price for Daraprim, an anti-parasitic drug that treats toxoplasmosis for infants, cancer, HIV, and AIDS in patients. It increased from $13.50 a pill to $7.50 a pill. Turing Pharmaceuticals bought the US rights to distribute it, and just like that, CEO Martin Shkreli made it impossible for people in need in order to buy it. It only cost $1 to make Daraprim, so why the 5,000% increase?
Listen, there's a lot of people who died of toxoplasmic every year, and this field desperately needs new ways to treat toxoplasmosis. There's no other way to kill it as of right now.
So, do you know the detrimental effects of raising the prices of Daraprim?
People in need can't buy Daraprim, and I'm so sorry for it, but we need money for research and development. Really, the only thing I'm sorry is that I didn't raise the price even higher.
So, are the lobbyists for Daraprim what causes the inflation? Can you explain more about that?
A special interest lobbying activity may go up or down over time, depending on how much attention the federal government is giving their issues. Particularly, active clients often retain multiple lobbying firms, each with a different team of lobbyists, to press their case for them, and for us, it costs about $75,000 to hire them. So I would have to say that yes, lobbyists are part of the reason why we were able to increase the price. Thanks to them.
People estimate that HIV patients and malaria patients on Daraprim will now pay anywhere from $336,000 per year to $634,500 per year. So, as a doctor, how do you feel about this?
Our healthcare system cannot afford to pay for all of these patients. We must move to alternative therapy that may not have the same efficiency. I am deeply upset over this monopoly of Daraprim's price. We continue to prescribe the drug, but it's so expensive that each authorization has to be specifically reviewed. It breaks my heart to see these patients denied of the one thing that can save them.
As a patient who uses Daraprim, how do you feel about this price increase?
I honestly feel violated. Like, Martin is the epitome of capitalism. I could die, and all I want to do is see my family. I wish he would change the price back to the way it was.
Mylan Laboratories raised the price of Ursidil, a generic medicine used to treat gallstones, by 542%. Additionally, there was a 400% boost in the price for diclomine, which combats irritable bowel syndrome, and a 312% increase for metoclopramide, a generic drug that treats gastroesophageal reflux disease. What was the price to make Ursidil, and how much do you charge now?
Uridisol's wholesale price was at 45 cents a capsule. Then in May 2014, we raised it to $5.10 a capsule.
Wow. So if a patient needed a whole prescription of Ursidil, they would have to pay around $100 for 20 tablets?
Looks like it.
Do you know of the disadvantages of raising the price like that?
Price increases without a real cost to patients. And if this turns out to a headline risk, there could be an impact to our reputation and shareholders. So I guess we look bad now, but we're making money.
Sir, as a patient, how does this affect you not being able to afford Ursidil?
Well, gallstones are hardened deposits within the gallbladder, and it's used to dissolve gallstones in patients who do not want surgery or cannot have it at all. So people like me who don't get the treatment will keep having pain in my abdomen. It literally hurts to move.
AbbVie Inc. raised the price of arthritis drug Humira to more than 126%. A typical fill can cost $3,275 or more for one carton, also known as 2 pens, of Humira. By adding up the cost for an entire year, price rose from $20,123 a year in 2010 to $45,565 a year. Why would you increase the price of Humira? It's obvious people cannot afford it.
We set prices to recoup investment in failed drugs, support new research and development efforts, and pay for clinical trials to broaden the use of approved drugs.
Can you tell me how the increase of Humira's price affected you? 哎呀，我这关节怎么那么疼啊！我太伤心了，我连这个保险费都付不了，这种 Humira 这什么药啊，什么破药啊，你知道吗？哎呀，我这个关节，哎呦太疼了，我连走路都走不了啊，太疼了。